Now, explain what you mean by monetizing that value. You can understand what you mean by the calculation of the cost savings, but how do you make money out of the cost savings come to fruition for one purchaser or another?
Yeah, right. No, so it's very complicated because some of these things we know, for example, dropping out of high school is hugely expensive, not only to the person who drops out in terms of their reduced earning capacity over their lifetimes, but also to society in general. Because we know that high school dropouts are more likely to be in prison, more likely to use the health system without insurance, more likely to do a lot of things that are sort of expensive in the long run. But we don't have a way to capture all of those savings and funnel it back into schools. Some things require that it be a discrete moment in time. So you walk through an emergency room door, that starts incurring real costs. If you are held back in school for a year or have to go into a special education class, that starts incurring costs that are real costs. And so what we try to do is figure out what are those things that really do cost money that are already allocated, and find a way that we can measure or track how our interventions reduce those costs and find a way to recapture that and bring it back. Now, a lot of mechanisms...
Let's hang on to the recapture and bring it back part.
Yeah.
So what are you meaning by that? So, bringing it back to what?
We can measure what that intervention saved us and return some of that savings to the investors. And so that's how we get the money back, is you sort of create a system. In this case, there's a treatment group and a control group. They have, the treatment group gets better counseling and better sort of job training and these other skills and case management, and they're finding that fewer people are going back to prison and those investors are getting paid back. Now that's one mechanism for this, but you could think the most interesting one to me that I've just learned about is a kind of a spin-off of the Affordable Care Act, and it's there are these new institutions called Affordable Care Organizations, or ACOs, and they operate similar to an HMO. You get paid per person per year to keep somebody healthy, not by procedure, and so. These ACOs are sort of set up to sort of really think about, we know that health happens in neighborhoods, and we know that so they're thinking about making investments into things like affordable housing, into good schools. The ACOs. And they are in a way a recapturing vehicle, because they can reallocate the money.
I know exactly what you mean, because fans of Spotlight who tuned in to a recent national audio conference call that we co-sponsored with the National League of Cities featured some developments in Providence where they are playing with a new idea to pilot bringing together the housing folks from the city together with a nonprofit insurer in the state of Rhode Island, where they will be taking housing stock and making it suitable for the elderly and handicapped, so that they avert the very expensive nursing home care and have healthier people at lower cost to the whole health insurance industry and to the families.
Yes.
And families are likely to help their loved ones recover sooner as well.
Yeah.
And so it's a real partnership. One of the issues, depending upon the findings of this pilot, would be, how then do you retrieve the quote-unquote savings? And if it goes from one pot of money, how do you transfer it between pots? How do you conceptualize what the pot is anymore? Is it still a health dollar? Is it a housing dollar? And how do we think anew?
Yes.
So that's a very big challenge. I imagine that's one you're thinking through too.
Right. I mean, it's often referred to as the wrong pocket problem, and so it's really, we've got to fix that. And it's
QB, wrong pocket problem. I love it.
So and I think what the work's going on in Providence is really indicative. And there are pilots like that all over the country. So you have, and some of them involve things like national church residences in Ohio experimenting with a Medicare and Medicaid waiver in order to sort of try to get those right those wrong pockets. So you definitely see this happening all over.
David, your closing words for folks around the country. What would you encourage them to do about this new vision for community development? How do they learn about it? How do they do something about it?
We always thought this was a start of a conversation. And in many ways, it's 41 authors in here, and they don't all agree. And they're people from the Cato Institute, and they're people from, nuns, and there are different groups from the far left as well. So you have all these different sort of interest groups represented. And I think, Barry Zegas was talking about how provocative this is, and how that's really, and I hope people sense that it's really intended to spark conversation. But ultimately, we want to get down to some concrete, how do we implement it? How do we and that's where we do spend a fair amount of the book talking about what are the nuts and bolts of trying to bring all this thinking together at the local level, but maybe even also influencing these other larger systems. And I think, ultimately too, that if there's, if you have an idea and you want to contribute, you have an idea of what works. We have a website, and it's intended to be interactive, and we already have a pretty active sort of blogging and Twitter and Facebook sort of activity around the ideas in the book, and we invite people to engage, because this really is an inflection point. We really are at a moment where we think we can fix these systems and really improve the lives of low-income Americans.
And this book was released in co-development with another organization. Can you
Yes.
fill us in on that?
Sure. So our partner in this was the Low Income Investment Fund, and they're a community development and a financial institution based in San Francisco. They have offices all over the country, but that's their headquarters. And Nancy Andrews, who's the CEO of that organization, was my co-editor for this. And they are a remarkable organization. They've deployed $1 billion to date. They've deployed $1 billion for 1 million low-income people, and they're increasingly thinking more and more about this idea of how do you sort of integrate their systems, and they're really on the vanguard of making this happen in transportation, in health, and in so many other areas, and we're really fortunate to have them as an intellectual partner on this project.
And we've been really fortunate to have you, David Erickson, from the Federal Reserve Bank of San Francisco, join us today in the Spotlight.
Thank you, Jodie. I appreciate it.
Thank you.